Who's Mike? Who's Mike? Ooh, a little stiff there on the get up, huh?
Mm-hmm.
Here with Mike today, we've got a low back pain injury in 2018, Division II football player. Just a little bit of edema, just a little bit of swelling. Okay, now lean back on me just a little bit here. Hold that together like that. All the way down. Now. We're here with Mike today. We've got a low back pain injury in 2018, Division II football player. No football injury, weightlifting injury, deadlift, squat. Felt a tweak in the gym ever since then. This is 7 years ago now, almost 7 years later. Still has a low back issue, has seen some chiropractors, no x-rays, so might be a good idea. We'll see how this progresses, but like after just a couple of visits, you know, I'll write a script for an x-ray. We'll see what's happening in there. You're old enough now and it's been too long that we should get a good idea of what's happening. Only one diagnosis from a chiropractor, which was facet syndrome, so we'll verify that in a minute. Let's see, so we do have some radicular down the left side, daily ache shooting with a positive well leg raiser test, which I haven't seen in a while, which is good. So some positive sciatic indications there, which would indicate a disc issue. Daily pain, making it hard. Can't put your son down in the crib, 14 months. He's not getting any lighter. We gotta get this taken care of so you feel better. And that, because you're gonna have to start playing football in the backyard soon, if not already. And then we have some neck pain too. That's happening at work. You're a corrections officer, so you're wearing a belt. You've got the gun and the tools and everything on there. Wait, do they give you a gun in there? They don't give you a gun, do they?
On transports, yeah.
On transports, yeah. Yeah, they don't want a gun in the prison.
No.
That's not a good idea. All right, so then neck pain with the sitting, and so that seems mild comparatively, not every day, not frequent. No extremity issues, and not taking any pharmaceutical medications. And was there anything that I missed there? Oh yeah, since Labor Day, you were on the beach running with the dog. What kind of dog you got?
Pitbull.
Oh yeah, they're the best. Okay, running with the pitty on the beach, misstep, and it's been acute since then, and that's it. Anything else back here? Okay, peanut gallery's quiet, and all right. So now that we've stood there for a little while, the posture compensations have set in. With the high left shoulder, we have a translation to the left and a high left ear. And so that translation means you're leaning away from the pain, which is on the left, right?
Correct.
That means we have a lateral disc, which means we can do a side posture adjustment today, which is important to know from here, which is good. All right, go ahead and march in place for me. Okay, you can stop right there. A little bit of external rotation on the right side hip with the right foot everted. Right evert, external. High left shoulder. Translation right. Lateral disc. Okay, go ahead and open or close your eyes for me, please. All right, watching for swaying motions here. Forward to back, left to right. Pretty dead on straight, which would indicate Category 3, which would suggest impingement somewhere with the appropriate antalgia. Okay, you can open your eyes. Cat 3. Okay, I've got a lot of work to do is what that means. It's good. All right, let's see. Go ahead and turn around and face the other way, please. Can you crack your own back?
Yeah.
Do you crack it down here? Do you twist it?
I twist, yeah.
Okay. All right, I'm going to look at your hips first, okay? Full back? What position did you play?
Tight end.
Tight end, yeah. Oh, I knew it. I'm usually pretty good. I can usually guess the position by looking. It doesn't even matter what sport. It's all archetype. You can always tell, especially in baseball. All right, high left hip. High left hip. Okay, I'm going to look at your glute folds here. You're going to feel my fingers on your hamstrings. Good. Low right glute with an EX left. PIIN right. ASEX left. Alrighty, okay, that's All right, top of the SI joint here, right or left or same?
They're about the same.
S2, right, left or same?
Going towards the left, yeah.
S3, right, left or same?
They're about the same.
S4, right, left or same?
Same.
Okay, S2, left is the only one right there, right?
Yeah.
Just a little bit of edema, it's just a little bit of swelling, but is that the compensation or is that all of the issue is the question. So we'll check the lumbar. Now, the thing with lumbar, if it is facet syndrome as the chiropractor, then it'll hurt when you do this. So let's do this. Let's lean back into my hand here. Tender, pain, stiffness?
Not really, no.
Okay, that's good. Now let's do this. Turn to the left. I want you to compare that feeling right there. Turn to the right to this feeling right here.
Nothing.
About the same?
Yeah.
Okay, we're going to have to push in a little bit deeper then when you're lying down. Okay, let's do this. Turn to the left again. Do it this way. That feeling there. Right side. This feeling there. Same?
No, the first one hurt a little more.
Restricted left range of motion on L3. Okay. One tender.
Yeah.
All right, put this arm out to the side for me. All right, push up against me right here. 5, 4, 3, 2, 1. Got that, relax. All right, put this arm straight out like here, good. All right, push up against me right here. 1, 2. Good, there, relax. All right, let's see here. Okay, ready? 1, 2, 3, 4. One more tender than the other, same.
2 was tender.
There?
Yeah.
All right, so the first thing that we're going to do is correct this rib. So go ahead and stand up. Go ahead and turn your face that way. Alrighty, I'm going to put my hand underneath your arm here like this. We're going to hold on to this rib. Now the same one over here on this. Okay, now lean back on me just a little bit here. Nope, sit back down. Too tall. Or I'm not tall enough, either way. Height discrepancy is the best way to say it. Alright, now let that relax here. We're going to try that one more time. 1, 2. Good. Okay, deep breath in. Good. That was better. Okay, put this arm back out. Push up against me. 1, 2. Not yet. Didn't go. Alright, hold it right here again. Okay, so we're going to try it a different way. Let that relax. Okay, put this arm out again. Push up against me here. Let that relax. Alright, just need to do one thing here. Hold your pinky and thumb together. Interesting. Hold that together like that. Let's relax.
I just did that before you came in.
Did you?
Yeah.
You ever have any aspirations to be in the healing profession?
No.
Okay. Alright, let this shoulder relax here. There we go. Did you ever bother you ever?
No.
What's this one here? Alright, now, let's see here. I gotta do this rib. And then put this arm on my shoulder. Go let that relax. Okay, you're gonna breathe in, then we're gonna breathe out. As you breathe out, let's lean back all the way down. Let the shoulders come down. Good, one more. Oh my God. can't believe this rib is so taunting me. Is that terrible? It seems like it's not bothering you that much.
No.
Okay. All right, let's see. Go and flip over to your belly. Alrighty, let's see. Yep, we got the right external. That's right IN. That's all checking out. The left S2, the right SI joint pointed outwards. Okay, here's L5. If I push here, do you feel any tenderness, pain?
A little bit.
L4, any tenderness, pain?
Yep.
L3, tenderness, pain?
Not too much.
Good. L3, L4. L3, L4. Ready? Right, left.
Left.
I'm going to bend your knees. We're going to bring this up. Do you have any back pain when I do this?
On the left side.
Okay. All right, I'm going to start unwinding the tailbone here, okay?
Okay.
Is it okay if I lower these down a little bit?
Yep.
All right, here we go. Here's the tailbone. We're going to make a contact right here on this ligament. Tender in there?
Not too bad, no.
Right there. A little tender on that one?
Not too bad.
Not too bad, okay, good. Did you guys have a good season when you were playing there? Would you say Kutztown, right?
Yeah. It was pretty good. I think went to the conference championship.
Nice. Yeah, that's pretty awesome. Where was it?
Honestly, I don't remember because
Did you suffer any concussions while you were?
I had a Liz Frank injury in my foot,
Okay.
and then pretty much ended my season. Then after that,
Okay.
and then I ended up quitting.
Gotcha.
Yeah, where you're pressing there in the neck is where I feel like the pain comes from, and then which leads to the headaches. Then.
Mm-hmm. Alright, now let's check and see if the tailbone has less tension in it. Okay, same feeling here, better, same, or worse?
It's about the same. I'm feeling it more like on my hip side.
Oh, so it changed? Or no?
Oh, I thought when you were asking me, it was like in the back area, but it's more the left side of the hip.
Okay. It was like that the first time I did it?
Yeah.
Okay.
Sorry.
Oh, no, it's okay. Nope, it's all information. It's all good. It just means we have to do a trigger point here. Right there. It's not going to be fun. Let's just get this over with now. Okay, you're going to breathe, Mike. Go and take a deep breath in. And out. Good job. Good work. You ever get any massage?
Yeah. Got a few deep tissues before.
Helpful?
Yeah.
How much stretching do you do?
None.
You drink any water?
Yeah.
Okay. The key here, at least in the beginning, is management. Okay.
Okay.
It's multifactorial healing this. I'll correct the alignment today for sure, and that'll make it feel better.
Mm-hmm.
And you know how things are just like aggravated, depending. I mean, some things will aggravate it if you have to, but if you get into a nice strong maintenance, with stretching and maybe there's a supplement we can think about, then you should live relatively pain-free. You should not have pain every time you bend down, okay?
Okay.
Excuse me, especially if you're bending properly. It doesn't take much. 10 minutes a day is enough to help you get to a point where you're more functional and have less pain.
Okay.
That being said, Case had an injury for 7 years, so you have to support his words. You know what I mean? He says my back hurts, and it's a big deal. Right? You can't push it. You can't push past pain and make it and do things because that's when it gets worse. Okay, the idea is to move in the right direction. You're young enough that you can heal a majority of this and live a relatively pain-free, high-functional life. You can live to 110 years old, and you'll never do deadlifts or squats again. That's it. You're done with those.
Yep.
But you should be able to walk or run on the beach. Actually, no. Walking on the beach is risky. It really is. The older you get, it's a risky thing. It just, the perturbating of sand is just not easy. You have to really pay attention when you're walking on the beach. You can't just go la-di-da. But the prognosis for this is good.
Okay.
You just have to be mindful and take some steps and work with it. You have to manage it. One day it won't be management. One day it'll just be, you just adopt a mentality or a mindset that, you're just not going to do certain things. And that's fine. Right short, stay short. Put the blocks in. Category 3. Right short. Left hip up, good down.
I'm the one that's been telling you for a long time to stretch.
Okay, but you can't do that. You can't, there's no I told you so in this.
No, I know.
It's just from
you're
now.
You're going to tell him it. Now he's going to go home and have stretch sessions, aren't you?
Mm-hmm.
I have to say, spouses are often right. I don't know why, but the thing that sucks is that spouses don't listen to each other. You can't. You almost have to trick your spouse into doing things. What you have to do is work off of FOMO, right? Mm-hmm. That's how spouses have to work. So what you have to do is stretch every day, and then just be like, wow, I feel so good. And then FOMO kicks in, and then all of a sudden you and Mike are stretching every day together, and it's a beautiful thing for a relationship.
Well, she has a lot of complaints too, so she needs to hop on the train.
I stretch them.
Okay. Okay, we're going to work it all out right now. Because physical and emotional are always wrapped up into one. And you guys are literally in one of the hardest places to be with a 1-year-old. Mm-hmm. It's rough, dude. I'm telling you, it is. So you have to take care of each other. You have to make sure you focus on your relationship. Your baby's fine. Baby is fine. You're not going to do anything to harm your baby. Your baby's great. You guys have to focus on each other and take care of each other for sure. Just make it you just treat each other like that person is a god or a goddess, and you just worship them. Everything they do. Never find content in the other person. You'll feel better in your body too if you treat your relationship like this emotionally too. Okay, so anyway, hold on. Where was I with that? Okay, stretching. Oh yeah, so in a couple of days there'll be some emails that come from my office, some automated emails. One of them has a bunch of stretching videos on it. Okay. And it's just like this quick 10-minute yoga thing that I do. I can't recommend anything more because it's like wringing your spine out like a sponge.
Okay.
You just take it slow, and you're just doing some stretching with the breath.
Yeah, we have hunting season coming up, so I gotta be able to
Oh, yeah.
Sit in a tree stand for hours. Not in pain.
Yeah, yeah. And be still, too. It's
Right.
I'm going to adjust according to the trap fibers here. Let's see. Okay, ready? 1 through 7. Which is the most tender? 1, 2, 3, 4, 5, 6, 7.
4.
Okay. 3, 4. 62. Okay, so that's T6 and L2. Okay, I'm going to push down on this here. When I push there, same or better?
Better.
Okay, if I push here, better or same, better?
Same.
Okay. All right, so we're going to start at T6. Hold on. Okay. All right, so we're going to start at this guy right here. Nice and gentle breathing. As you breathe out, I'm going to follow your breath. We're going to give a little push right there. Good, nice, gentle, good, sink in, good. Okay, that was nice. All right, one more little one here at the top. Good, deep breath in and out. Good. Okay, that's fine. Man, there was tension up there. There's so much heat coming off the left side of your spine right now. Maybe that was part of that headache. This left shoulder blade.
Yeah.
That right there, right?
Mm-hmm.
Rhomboid. How's this trigger point down here? Does this still suck?
Better? It's a little better, yeah.
Okay, we're going to do this trigger point here. Okay, deep breath in and out. Good. One more breath. And out. Good. Okay, L2. L2 matches with C4. Right or left? Which one's more tender here?
Right.
Left or right? Left or right?
Right.
L2. PRS. This. Here. Here. Does this suck right here?
Not too bad.
No. Bend this right knee here. Good. Okay, very gently push against my hand right here. Okay, let that relax. Okay, that's nice. Lift this leg up in the air. Push up against my hand. Okay, that's good. Okay, I'm going to do this. I'm going to put the table up underneath of your hips. I'm going to push down and you're going to feel the table drop, okay?
Okay.
Okay, I'm going to bend your knees. Don't help me. Let me do it. Make sure it crosses over. That's good. Here, okay, so first we're going to adjust the lumbar. Nice and gentle breathing. Oh, that was... Was that one right there, or was it down here? Was it here or here? I didn't have my hand on it. I couldn't tell. All right. Well, the heat's coming off your lumbar, so we're going to start with that one. Okay, this is going to the right, and it's turned like this. Bring it back clockwise. Okay, so you're breathing. We're going to give it... There's more. Hold on. Take a deep breath in and out. Good. Okay. Goes too easy, though. That's not the problem. Whoa, dude. That's a lot of cracks. Okay, we're going to do one more on the SI joint now. This is PIIN, so we're going to bring it down like this. With the shoulder coming up like that. Take a deep breath in and out. Good, 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 good. Shoulders sink in. Good. All right, lie on your back. Pain there? Did you feel it? Did it tighten?
Not really, no.
Okay. Okay, now we're going to give this a push here. We had S2 on the left. Gentle breathing. This is ASCX. Going this way and out. We're going to bring it back in. Right there. Okay, deep breath in. Out. Nice, gentle breathing. Good sinking. Good. Good, letting it all go. Yeah. All right, lie on your back. Like sometimes your spine's like, yeah, this is definitely sciatica. And then other times your spine's like, nope, not sciatica at all. Like it's like your SI joint.
Mm-hmm.
So it's hard to say. I think that maybe you sprained your SI joint at the beach. And that's what's new.
Okay.
But long term, there was a disc injury.
Okay.
I don't find any evidence of facet injuries.
Okay.
But maybe at that time you did have a facet injury. You know what I mean? It changes over time. How do you sleep at night? First of all, well or not?
I sleep good.
Okay.
But when I wake up and try to stand up, that's when I get pain.
In the morning.
Yeah.
We just went and got a brand new bed too.
I
Good.
thought that was a problem, but
Back in, what was it? Like Memorial
May.
Memorial
Good.
Day weekend.
Yeah.
It's a big deal. Did it help? Is it better?
Yeah.
Did it?
For like the first 2 days, I felt great, and then after that, it's been the same ever since. The pain.
Okay. Stiff bed, soft. What'd you get?
Medium.
Yeah, it's like right in the middle.
Okay. That's actually probably that's about right for you guys. All right, let's do this. Turn your head to the right. Back to center. Turn your head to the left. Back to center. Bring your right ear down to your shoulder. Center. Left ear. Center. Pretty interesting there. You have an occiput. That's good. I mean, everyone has an occiput, but you have an occiput finding. That happens with headaches a lot. Okay. You got any sinus issues?
Not that I know of.
Allergies? Good.
Yeah, pretty good.
How's your digestion?
Could be better.
Okay. Bowel movements? Too quick? Too slow? Indigestion? Heartburn? Bloating?
No.
Okay. Pain?
She wants me to get checked for IBS.
Okay. Do your bowel movements fluctuate between too fast and too slow?
Yeah.
Okay. Okay, you've been checked for IBS. That's pretty much what a doctor... That's pretty much a check for IBS. There's nothing else that they can do. It's just ask you questions and it's all based on symptoms.
Mm-hmm.
Now, you can do a colonoscopy and see what's happening in there, but also too, IBS is definitely linked to stress. As a matter of fact, the first thing that doctors will ask, and internists will ask, if you have IBS, like what your stress levels are like. So the ashwagandha is good, and also back pain will also contribute to that.
Mhm.
Sucks right there.
Mm-hmm.
Right, let me see what the occiput says. Let this relax here. No occiput. All right, tuck your fingers in here underneath your hips. Good. That right there. How long have you had those symptoms for? Digestion. Lifelong? 1 year, 2 years, 5 years, 10 years?
Probably like 5-ish years.
Okay. How long you guys are married?
2? 3? 2.
Okay. Okay, nice and gentle. We're gonna start off on the right side here first. I'm gonna bring your head over to the side. A little push right there in that direction, like that. Good, you're doing good. You're nice and relaxed. Dude, you're like the best patient. You're just so chill and relaxed. You just every single time. There's not one thing that I shouldn't have said that too early. So anything, yeah.
I was just hoping that today could bring some relief.
Mm-hmm.
So, I'm yours.
Cool, man. Thanks for that. Appreciate it. Appreciate the trust. Definitely going to get some relief and some long-term action, long-term progression. We want to trend.
Mm-hmm.
We want to trend in the right direction. Okay, nice and gentle here. Let the head drop here. Shoulders. It's really nice. Can you crack your neck too?
Yeah.
Feels like it on that left side. All right, I'm gonna crack your toes. Nice. Okay, little pull. Tender?
Mm-hmm.
All right, I'm gonna palpate your abdomen, okay?
Okay.
Sometimes one of the keys with IBS, you know, and only, it's just irritable bowel syndrome. Just means it's not like a disease that you have. You know what I mean? It's not like a condition.
Mm-hmm.
It just like means that really a little bit of diet mindfulness, and really eating mindfulness too. You know, when you get stressed, you tend to just eat really quick, eat a lot really quick, which doesn't help.
Mm-hmm.
Not chewing. And then, you know, certain things just agitate your gut. You eat a lot of dairy?
Yeah.
You know, as you get older, what's your heritage, do you know?
Polish?
Polish? I don't know much about the Polish. I don't know how much dairy they had. They were...
Are you Irish as well?
I mean, people ask me that because of my red beard.
No, I thought Sharon was Irish.
I think she's the Polak.
Oh, okay,
Mhm.
never mind.
Sometimes as you get older, your ability to digest dairy decreases. And that can cause irritability. And that's one of the easiest things to isolate.
I feel like I've noticed that a lot, like getting a milkshake that sends me.
Boom. It's done. It's over. You're lactose intolerant. Okay. You're an adult and you don't get milkshakes anymore. But I swear to God, Mike, that's exactly how I figured out that I was too. Because I stopped at Burger King and I was like, I need a Frosty today. Like, I'm gonna dip some fries in a Frosty and be happy. And that's when my fingers started to hurt, and I was like, oh my God, these arthritis symptoms that I'm having are being exacerbated. So your back pain, when you're stiff in the morning, all stiffness in the morning leads down the pathway diagnosis up in arthritis. Now, arthritis is the same thing. It's not a disease that you have. It's inflammation of joints. That's all. Arth means joint, itis means inflammation. And so, like, if you don't do the things that create inflammation, you no longer have inflammation, and therefore you no longer have that diagnosis.
Right.
So, easy one to eliminate. And, like, you might even find, and I usually recommend you do a hard detox of the dairy, no dairy whatsoever at all for a good month. And then you can experiment, hard cheeses typically do a little bit better. And with lactose intolerance, usually you can tolerate anywhere up to a cup of dairy, but maybe like a half a cup. So like maybe if you have a sandwich with a slice of cheese on it, it's not going to be that big of a deal for you. And that's just it. And you just make different decisions, and trust me, it's really not that big of a deal. Cheese is the ultimate cheat of culinary, okay? Anyone can make anything taste good with cheese. Learning how to cook with salt and pepper and oil and vinegar is really what it takes to be a master in the kitchen. Not that I cook at all, I don't. Let that relax right there. Okay, good. There we go. Nope, this side's not as bad, right?
No.
Okay. All right, put that one away there. It's terrible down here or what?
It's tender.
Yeah. That sucks right there, right? You ever been in any car accidents? Motorcycle accidents?
Nope.
Bow hunt or rifle?
Both.
Nice. Alright, go and lift up your head and down. Let me see your arms here. We're gonna give this a little pull. Good. Okay, hands right there. Alright, sir. You're breathing just like the other adjustments. I'm following the breath, and as you breathe out, we're gonna go in this direction like that and a little pull. Good, you're doing fantastic. Just sinking in, shoulders and hips. Good. We'll follow the next breath cycle out. You're doing good. Just letting it all go. That's good. Nice.
That was nice.
Yeah, it was good. Did you feel all the way down?
Yeah.
Okay, good.
I really felt anything like that.
There's no other way to feel it. It's really a one of a kind experience. That was nice. All right, that was clean and it was nice. And all right, let's see. Stand up. Let's take a couple steps.
Feel pretty good.
Good. All right, let's see. Turn around and face this way, and then just give me a real slow bend forward, but stop where there's pain. All right, you can come back up from there.
I mean, I felt the
Yeah.
barely where I felt it before, like in the lower back,
Point
left
to it.
side.
Point to it. Where? Oh, that whole little glob right there?
Yeah.
Oh, okay. Okay, so let's do this. Lie back down on your belly. So, multiple things are happening here, for sure. I think it's important not to get too caught up on a diagnosis, so to speak.
Okay.
It's all working together, you know what I mean? Your SI joint needed adjusted, the pain's coming out of the glute muscle, which would indicate SI joint dysfunction. And then, but you definitely had what sounded like a disc injury just based on the mechanism. So, with multiple things happening, it's a good idea to see how you respond to care and then just get one picture taken of the area.
Okay.
So I'll write a script for you. It's been 7 years, so let's take some of the guesswork out of it, and that gives us our best prognosis. You know, we know for sure what we're dealing with, and I have to retract that a little bit because we don't always know for sure just because we take an X-ray. You know, it gives us some good ideas.
Right.
But there's people walking around out there right now with herniated discs. You know, discs are falling out of their spine, pressing on there. They have no symptoms. Part of it's because of inflammation. People can have relatively worn out spines and not have any pain, but it really just comes down to inflammation. Alright, so if you want to take some notes over there, if your phone's out, then write down Solgar chelated magnesium. Solgar chelated magnesium. Solgar chelated magnesium is the best. It's just a one a day, and you want to take those at night. I'm gonna put some magnesium on this right here.
Okay.
Even the kid's on magnesium.
Your kid?
He has a lotion
For what?
for sleep. It's just like a little lotion you put on their feet.
What else is in it?
Coconut oil.
Okay. Is he not sleeping? I mean,
It's
14
to
months
help
old.
him like wind down at night.
Yeah, boys are wild.
Mm-hmm. I said it was working, but we didn't use it a couple different nights, and he was the same way. So
Okay.
I don't know if it's working.
Mhm. You know, this is contrary to anything I've ever read in any parenting books, but I used to rile my kids up before bedtime.
Mm-hmm.
Like, that's it. I would try to make them go jump on the trampoline and throw them all over the place. I'd make them run laps around the house. And then, you know, you start the bedtime routine. The routine, it worked for one of my kids, but the other one figured it out.
Mm-hmm.
She was like, no. She, like, knew it was time, you know?
That's him right now.
Mm-hmm.
Yep.
I mean, he still loves like his bath, his toothbrush routines, but
Good, that's good.
as soon as we sit down in the rocking chair, he
No.
knows,
Uh,
and he's wiggling out of it, and he's on the floor, and he wants to play.
you reading to him?
Oh,
Just keep
yeah.
reading. Just keep reading. Yeah. It's rough. I know it's rough. Just hang in there. You get through it. Everyone does.
Well, this past month, he got 4 new molars, all in a month. So it's been a little up and down.
Marshmallow root. That's what I used to use for
Okay.
for teething. Put your hands on your hips. And then push your elbow back here. Push, push, push. Good. Push here, push. Good. Now relax. Bring this down. Okay, this feels better up here in your shoulder.
Mm-hmm.
All right, you're gonna feel better from this. Everything that I need to cracked perfectly. A little bit of work today. A little bit of work to do, okay?
Okay.
You're already drinking enough water, right?
Yeah.
A little bit of stretching, a little less dairy. Main two things. A little bit of stretching with less dairy. You throw some magnesium in there at night. This is a different life for you. You know, you're headed down a different path. We jumped timelines. We did a quantum time jump today. And now you're headed to something completely different. That's weird that I said that. I never said that ever before. You don't need a million chiropractic adjustments. You're doing actually a pretty good job with your self-cracking. And you're relatively limber in here, and I got that SI joint to move it, so that's going to be big.
Okay.
So why don't you go and do some of the things that you need to do and let this sink in. We should do one follow-up and maybe one after that. But as long as you're improving and heading in the right direction, the more that you're stretching, the less you'll need me.
Okay.
So, what was your ride to get here? Where'd you guys come from?
It's about an hour.
An hour? Okay. Not easy to run back and forth if you're an hour, but 2 weeks is good. 4 weeks is okay. 6 weeks is okay, but we're starting to push it a little bit from there, from a follow-up. I mean, maybe this just corrects everything and you don't even need a follow-up, which is best case scenario and awesome and possible.
Okay.
But I would maybe plan on one for probably somewhere around a month, give or take.
Okay.
When we do another decompression, we'll just take it one visit at a time and go from there.
Sounds good.
Okay, you have any questions?
Nope.
You have any questions?
Yeah. So, how do you feel about like foam rollers and things like that? We have those at home.
Mhm.
Should he use that?
Love it.
Okay.
Yeah.
And
Motion is lotion. Anything you can do with motion is good. Yeah.
okay. You said that you were giving him a script for an X-ray,
Yes.
and will they send that right here?
Yes.
And then,
You can take it to any imaging center.
okay. And will that sort of like change at all of whether he should come back sooner or later?
It will not. Not really. No,
No?
It won't. But it'll just change like the conversation of like how what the actual prognosis is, and you know what healthy expectations are.
Okay.
Like, okay, it's either going to be like, okay, this is something that you're going to need to manage pretty hard for a while and really stay focused on it for a long time. Or it's going to be like, listen, you just need to pay attention and do a couple little things and you're going to be pretty good pretty soon. You know, and that's the spectrum. My feeling is that we're probably closer to the latter, where it's just like, let's just pay attention to it a little bit. You're young enough that your body will heal. And if you do the things that you need to do, then you're going to feel relatively good for a while.
Okay. Guess it's time to get stretching then.
You guys do it together. It's going to be fun.
Yeah.
Thank you.
You're welcome. Yep.
Thank you very much.